Today we are going to discuss about the behavior therapy. Behavior therapy is a form of psychotherapy that aims to change maladaptive behavior by using techniques based on principles of learning and conditioning. It focuses on observable behavior and aims to replace problematic strategies such as reinforcement, modeling, and systematic desensitization. Let us move on the definition of behavior therapy. Behavior therapy is a type of psychotherapy which is based on the theories of learning and aims at modifying maladaptive behavior and substituting it with adaptive behavior. The behavior therapy indicated for various mental health conditions and behavioral problems, including anxiety disorders such as phobias, generalized anxiety disorder, and social anxiety disorder. And the next condition is depression. In depression, the individual they may having the maladaptive cognition, obsessive compulsive disorder, post traumatic stress disorder, and then attention deficit hyperactivity disorder, and the individual those are having the alcohol and drug dependence. So the adolescent most commonly they may having the eating disorders, particularly bulimia nervosa and binge eating disorders. In sleep disturbances, particularly insomnia and other sleep disorder conditions, we are giving this behavior therapy. And another condition is anger management, relationship problems, chronic pain management. In these are all the conditions this behavior therapy indicated. And the last thing is autism spectrum disorder and developmental disabilities. It is most commonly we can noticing these things in a childhood disturbances. So these are all the indication it is available for the behavior therapy. So there are many theories of learning. Majority of the behavior therapy techniques it is based on the operant conditioning model. That is Skinner operant conditioning model and classical conditioning model that is given by Pavlov. Many of the ideas actually seems like common sense principles. The learning theories assume that all the behavior is learned behavior. Behavior therapy is typically a short duration of therapy. The therapists are easily to train and it is usually cost effective. The total duration of this therapy usually 6 to 8 weeks. Initial sessions are scheduled daily, but later sessions are more spaced out. Let us move on the techniques of behavior therapy. The first we can see about the systematic desensitization. Systematic desensitization is based on the principles of reciprocal inhibition. It is described by Joseph Wolf. In this, the patient attain a state of complete relaxation and are then exposed to the stimulus that elicit the anxiety response. The negative reaction of anxiety is inhibited by relaxed state, a process called reciprocal inhibition. This reciprocal inhibition consists of three main steps. The first thing is relaxation training. There are many methods which can be used to induce relaxation. Some of the methods are Jacobson progressive muscle relaxation, hypnosis, meditation, yoga, mental imagery, and biofeedback. Second thing is hierarchy construction. So here the patient is asked to list all the conditions which provoke anxiety. Then he is asked to list them in a descending order of anxiety provocation. Thus, a hierarchy of anxiety producing stimuli is prepared. The third step is systematic desensitization proper. This can be done either in imaginary or in reality. At first, the lowest item in hierarchy is confronted. The patient is advised to signal whenever the anxiety occurs. With each signal, he is asked to relax. After a few trial, the patient is able to control his anxiety. Thus, gradually, hierarchy is climbed till the maximum anxiety provoking stimulus can be faced in the absence of anxiety. The systematic desensitization is a treatment of choice in phobias and obsessive compulsive disorder. The next step is flooding. This is usually a method used in the treatment of phobias. So here the person is directly exposed to the phobic stimulus, but the escape is made impossible. By prolonged contact with the phobic stimulus, the therapist's guidance and encouragement, and therapist modeling behavior, anxiety decreases and the phobic behavior diminishes. The next techniques call it as aversion therapy. Aversion therapy is used for the treatment of conditions which are pleasant but felt undesirable by the patient. Example: alcohol dependence, transvestism, ego dystonic homosexuality, and other sexual deviation. The underlying principle is pairing of pleasant stimulus with an unpleasant response. So here the pleasant stimulus is alcohol. Here the unpleasant response is brief electrical stimulus. So that even in the absence of unpleasant response, the pleasant stimulus become an unpleasant by association. The unpleasant aversion can be produced by electrical stimulus by giving the low voltage drugs such as apomorphine and disulfiram therapy, or even by fantasy when it is called as covert sensitization. So this is called aversion therapy. Typically 20 to 40 sessions are needed. With each session it may lasting about 1 hour. After completion of the treatment, the booster session may be given. The current use of aversion therapy has declined sharply in Western world as it felt by many that is maybe violate the human rights of the patients. The next technique is operant conditioning procedures for increasing the adaptive behavior. So here the common methods for augmenting an adaptive behavior include positive reinforcement. So here the desired behavior is reinforced by reward. either material or symbolic. When a behavioral response is followed by generally rewarding events such as food, prize, or gift, it tends to be strengthened and occurs more frequently than before the reward. This technique is used in the this technique is used to increase the desired behavior. The next techniques is token economy. This program involves giving the token rewards for appropriate or desired target behavior performed by the patient. The token can be later exchanged for the other rewards. For example, in inpatient hospital ward, the patient receive a reward for performing a desired behavior, such as tokens which they may use to purchase luxury item or certain privileges. The next techniques coming under the behavior therapy is operant conditioning procedures to teach behavior. The first thing is modeling. In modeling is a method of teaching by demonstration wherein the therapist shows how a specific behavior is to be performed. In modeling, the person observe other person indulging in target behavior and getting a reward for those behavior. This will make the patient repeat the same behavior and earn reward in the same manner. The next condition, that is the next techniques coming under the operant conditioning procedure to teach the new behavior. It is called shaping. In shaping, the component of particular skill, the behavior is reinforced step by steps. The therapist starts shaping by reinforcing the existing behavior. Once it is established, he reinforces the responses which are closest to the desired behavior and ignore the other responses. For example, to establish eye to eye contact, the therapist sit opposite to the patient and reinforce him even if he move his upper body towards him. Once this established, he reinforces the person's head movement in his direction, and this procedure is continued till eye to eye contact is established. The next technique is chaining. So the chaining is used when a person fail to perform a complex task. The complex task is broken into a number of small steps and each step is taught to the patient. In forward chaining, one start with first steps and goes on to the second steps, then to the third and so on. In backward chaining, one start with last steps and goes on to the next steps in backward fashion. The backward chaining is found to be more effective in training the mentally disabled individual. The next techniques coming under the behavior therapy is operant conditioning procedures to teach new behavior. So here some of the techniques it is coming under that. What are all the technique means? The first one is extinction or ignoring. Extinction means removal of attention or reward permanently following the problematic behavior. This include action like not looking at the patient, not talking to the patient, or having the no physical contact with the patient, etc. So the following the problematic behavior. So this is commonly used when patient exhibit the odd behavior. The next technique is punishment. So here the aversive stimulus is presented contingent upon the undesirable response. The punishment procedure should be administered immediately and consistently following the undesirable behavior with clear explanation. Differential reinforcement of an adaptive or desirable behavior should always be added when a punishment is being used for decreasing an undesirable behavior. Otherwise, the problem behavior tend to get maintained because of the lack of adaptive behavior and skill defect. The next techniques coming under the next technique is timeout. Timeout method includes moving the patient from reward or the reward from the patient for the particular period of time following the problem behavior. This is often used in the treatment of childhood disorder. For example, the child is not allowed to go out of the ward to play if he failed to complete the given homework. The next techniques coming under here is restitution or overcorrection. Restitution means restoring the disturbed situation to a state that is much better than what it was before the occurrence of problem behavior. So, for example, if a patient passes urine in a ward, he would be required to not only clean the dirty area but also mop the entire or larger area of the floor in a ward. This is the punishment it is given in a restitution. The next thing is response cost. So this is a procedures is used with the individual who are on token program for teaching adaptive behavior. When undesirable behavior occurs, a fixed number of token or point are deducted from what the individual has already earned. This is called as token um, response cost. The next techniques coming under the behavior therapy is assertiveness and social skill training. Assertiveness training is a behavior therapy technique in which the patient is given training to bring about change in emotional and other behavioral pattern by being assertive. The patient is encouraged not to be afraid of showing an appropriate response, negative or positive, to an idea or suggestion. Assertive behavior training is given by therapist first by role play and then by practice in real life situation. So here the attention is focused on more effective in interpersonal skill. Social skill training help to improve the social manners like encouraging eye to eye contact, speaking appropriately, observing simple etiquette, and relation to people. So these are all the techniques it is started in a assertive training and social skill training. The next thing or the next techniques it is coming under the behavior therapy is operant conditioning procedures for decreasing maladaptive behavior. So what are all the techniques or what are all the methods here employed means the first one is timeout. So here the reinforcement is withdrawn for some time contingent upon the undesired response. The timeout is often used in a therapy with children. The second method is punishment. So here the aversive stimulus is here presented contingent upon undesired response. That is, whenever undesired response occurs, the punishment is given to the particular individual. The last technique is satiation. So the satiation, what is meant by satiation means the undesired response is positively reinforced so that tiring occurs. So that tiring occurs. A similar technique is negative practice procedures. To stop a child from acting in a particular way, you may allow him to continue performing the undesired act until he tires of doing it. So this is called it as satiation. So these are all the some of the behavioral techniques it is employed in a behavior therapy. I think all of the students you may got my point. So if you are having the any doubt means in the comments you can give me. I will give the clear cut explanation to you. Thank you. So in next video we will see the other kind of therapies and other topics also. Thank you. Thank you for watching.